guys, thank you for joining us on the Rebatho's Foundation exclusive interview. As we're still continuing on our Stop It campaign, we are bringing you the ins and outs of what you need to learn during and after this lockdown period. With me, I have a young pioneer by the name of Keamogetswe, well known as Keamogetswe. To tell you a bit more about our guest today is, Keamogetswe is a young, ambitious lady born and raised from Gabankua, north of Pretoria, where she's easily known for her character of being an influential person determined in her strides from a tender age. In the year of 2012, Keamogetswe obtained her matric certificate from the Mondo High School. In the year of 2016, Keamogetswe obtained her honors degree in BSc Physiotherapy at the Wits University. In the year of 2017, Keamogetswe completed her community service work at the Dr. Mokari Academic Hospital. She then joined a private practice in Rosebank, where she was a junior physiotherapist. She then resigned to register her own private company by the name of KM Physiotherapist, which is based in Pretoria. Not only working in her private company, she's also full-time employed at a well-known hospital by the name of Life Eugene Marie's Hospital. Keamogetswe, thank you for joining us on our space and welcome.
Thank you, Lerato, for having me. I look forward to this interview.
Perfect. Now, you being an essential worker during this lockdown, can you give us the ins and outs of how is South Africa doing right now?
So, Lerato, I think it's trying times for all of us in the country, being told to maintain social distancing, being told to stay in our homes, and being confined in the same space all at the same time, especially if you have kids in the house. I think it is a trying time for all of us, and we need to be patient and we need to be very prayerful in this time. In terms of working as a physiotherapist in this time, at Eugene Marie, we do specialize in rehabilitation. So we still do see patients who require rehabilitation after having an injury or having gone an operation and many other diseases and illnesses that require physiotherapy. So kind of life still does continue as normal, but obviously we're taking into consideration the precautions that we need to take in order for us to make sure and to ensure that we are safe in this time.
That's true. Now, regarding our physical well-being and being always fit and exercising, in my confined space, having my kids and with the family, how can one practically keep the momentum of being active?
So yeah, I know that we're all in one space and there's literally nowhere to go. We have to stay indoors as much as we can in order for us to avoid contact with the outside world. But there are a few exercises that you guys can do at home with the family that don't need equipment, that don't need for you to be outside, that are fun, which I will show the exercises to you in a bit later before we finish the interview.
That's perfect. Now, this means that even the little ones can also join us in these exercises?
Definitely, because those ones can be a bit a nuisance, so we need to keep them busy during this time and active. So yeah, they definitely will also be indicated for them to do at home with the parents.
That's great. Now, most of the people currently who are working from home, what are the essential key things that we need to know, that we need to do when we're working from home in this lockdown period?
So just to mention something quite important, ergonomics, which is an aspect in physiotherapy that we focus on, where we look at the workplace environment and how we can make the workplace conducive to the worker. There are a few things that one should ensure that they do and that they remember to incorporate while working from home. The first thing is to always keep hydrated. So always have a water bottle, a glass of water on the table as you're working. The other thing, it's important to take frequent breaks in between. So we usually advise that you should take between 2 and 3 hours. You should take breaks in between, making sure that you're walking, you are restoring your circulation. And then there are a few things that every desk bound person should ensure. The first thing is that make sure you are comfortable and your back is upright. So if you want to get a chair with a back support, that would be good to make sure that the back is always upright. If you don't have a chair that has back support, you can always use pillows to prop yourself up to make sure that the back is upright. Then the other thing that one should consider is that make sure that the desk is close enough to you so that your elbow is at 90-degree angle. So if your desk is very high, your elbows will be flexed and your wrists will also be extended. That would make the wrist quite uncomfortable for you to work in. Making sure that the desk is low enough so that you can maintain a 90-degree angle at your elbow is quite important to take note of. The other thing is that I know sometimes sitting for a long time, your legs can get tired and you'd want to put your legs on a stool or on a bench or on a chair. So it's always also good to make sure that you do that quite frequently. If you want to rest your legs, you may, but don't do it for a long time. So don't do it for more than an hour, because what that does, that when you're sitting with your legs up, the pressure that is from your upper body then moves to the lower part of your spine, which then increases pressure on that area. So those muscles around the back are overworking, and then that could be uncomfortable and that could cause lower back pain. So make sure that if you do rest your legs, then in between around 30 minutes, then put them down again and allow your legs to be well rested on the floor at a 90-degree angle of your legs, of your knees rather, and your hips.
That's great. Now, a question that has been circulating and many people have been having this question is that, is there a difference between a physiotherapist and a masseuse?
Yeah, that's a good question, because there are a lot of misconceptions about what the role of a physiotherapist is. So physiotherapists treat physical impairments that may have been resulted from having an illness, having a disease, or even aging. So physios aim to restore the normal functioning of the body. And this we do by prescribing therapeutic exercises, educating the patient about the importance of managing their condition on what their condition actually is. What we also do is that we give or provide rehabilitation to those people who may need rehabilitation. Physiotherapists also provide manual techniques or manual handling or manipulation to joints and also to your chest area if ever you have a chest condition. And we also use electrotherapy. So that's just a whole bunch of machines that we use in conjunction with therapy. And in terms of the manual handling, I forgot to mention the massage aspect. So massage is a technique that physios use in conjunction with other modalities that I've mentioned to restore normal functioning of the body. Whereas a masseuse, rather than they focus only on massage, only on bringing relaxation to the body or to the muscles, which the client may need. So that's the major difference, is that we don't only focus as physiotherapists on massage. Massage is used rather as a technique in conjunction with other therapy modalities, whereas the masseuse just focuses on massage, just focuses on getting the body relaxed with, heat and all the other modalities that they use.
Upon what you said, no, yes, it does very much. I think I have that understanding as well. Now, on what you said, if I'm a person who regularly has a neck or back pain, do you advise that I go and see a physiotherapist or rather just go get a massage?
So that's actually a brilliant question, Lerato, because sometimes we have clients or I have clients that come and say they just need a massage. If the massage is not indicated as a result of pain or some sort of muscle or joint discomfort, then medical aid, to be more specific, does not pay for someone having a massage. So then I would then refer them to rather go see a masseuse. But if the massage is indicated for pain, for discomfort that may be in the joint or the muscle, then definitely we as physiotherapists use massage in conjunction with stretches, in conjunction with exercises to restore the back or the neck or whichever part of the body that has been malfunctioned. So just to answer your question, yes, we do see some clients who request massages, but we rather would refer them to a masseuse if all they want is relaxation. But yeah, if there's pain, if there's discomfort, if there's any kind of neuromuscular condition that the patient or the client is indicated with, then we do assist as physiotherapists.
Okay, I think I understand that now. Now I would like us to move to our practical exercises that I want us to show. Now, mostly because we're working from home and we used to work from the office space. Now, what are the areas that you can show us to exercise to keep routine now and even after when we go back to office space in terms of actually focusing on our neck, our back, our arms, our wrists? How can we keep that in training on our everyday life now until and after lockdown?
Okay, so that's the fun part. So what I'm going to do is just illustrate to you a few exercises that people at home can do. These are cardiovascular exercises and strengthening exercises, but I'll also show stretches that one can do when you start feeling some stiffness in the neck or in the wrist or even in the back. So I'll show you at this moment. So we're going to start with some of the cardiovascular exercises that one can do. You can do this with the family, with the kids, everyone can be part of it. So what I usually advise, not everyone has availability of a weight or a dumbbell that you can use. So nice thing to do is get yourself a bottle. I use 5-liter bottle, but you can use from 1, 2 to 3 liters and pour or fill the bottle with water or soil just to add a bit of weight. So the first exercise that we can do is for the arms. So you lift the bottle up and down 10 times, making sure that your back is straight and that both your arms are equally feeling the weight on your arms. Okay, so that's the first exercise. The second one is if you move the weight or the bottle forward and back, making sure that your elbows are going all the way back and not just landing there. So all the way forward and back 10 times, 3 sets. Okay, so that's it for the arms. Now going to the legs, because I know we just need to burn the fact that we've been eating on our legs. This is a nice one to do. So you can sit on a couch or a chair, move all the way forward, okay, to make sure that your bum is off the chair or the couch. Lift your legs up and down 10 times both sides, 3 sets. So in between the 10th repetition, you can go back and sit and rest and grab yourself a glass of water and then go back to resume to your next set of exercises. So you can do that also 10 times 3 sets. And then the last one that I'm going to show you is for the arms. So going back to the arms for those who can, this is quite a hard one. We call them tricep dips. You go all the way down, and so you're sitting on the floor, and then you put in your body all the way up. Okay, making sure that you keep your body and your back straight. Because the minute you lean over, then you cause irregularities and muscle imbalances on your upper body. So I'll just show that one again, making sure you all the way forward, go down and up and down and up 10 times, and also that you can do 3 sets. Okay, so now moving on to those who are working on the desk and obviously starting to feel muscle stiffness around the neck and the back. The first stretch I'm going to show you is for the neck. So if you pull your head down, making sure you feel the stretch on the back of your neck, hold that for 10 seconds, and you can do that twice, so 10 seconds, and you count up to 10, and then do it again. So you do it twice for 10 seconds, and hold, making sure that you allow the muscles to lengthen and stretch. Okay, then when you're done with that, you can pull your neck to the side, making sure that you feel the stretch. What's also nice to do is you put your arm underneath your thigh or your bum, making sure that you get that neural stretch as well. So this is more of a neural stretch. But you're getting a stretch also in the neck part of your muscle. So you hold that for 10 seconds, and after the 10th second, you go back and then you do it again. Okay, then you hold for 10 seconds. And obviously you're going to do the other side, pull all the way through the stretch, and then hold for 10 seconds. Okay, I think that would really do some relieving around your neck, because it does get a bit strenuous to be sitting looking at the screen monitor for a long time. I just wanted to quickly also show the last stretch for your upper back. So I know that most of the people are leaning down. So it's always important to remember to keep your back straight. So always, always keep your back upright. If the minute you bend forward, then your upper back gets strained, and that strain then gets translated to the lower part of your back. So what you can do to stretch your upper back is pull on your shoulders, bend your neck down, and then pull all the way down in order for you to feel the stretch on the upper part of your back. If that doesn't give you relief, you can open up your legs, go all the way down until you feel the stretch on your back. This will also give you some relief on the lower parts of your lower back muscles. So let me show that again. So you pull all the way forward, you bend your neck, you go all the way down and you hold it. You hold that for about 10 seconds as well. You come up, you pull all the way up, you look up to the ceiling, making sure you're getting some extension in your back. You can also hold that for 10 seconds, and then that's one set. So then you're going to do that again 2 to 3 times depending on the severity of the back pain. So yeah, that's it.
Oh wow, thank you so much for those exercises and stretches. I think I needed them personally because I was not sure of how I'm sitting, because sometimes we want to work for more comfort, like I want to work in bed or sitting on the couch and all of that. So I think learning from this, oh my gosh, I need to change my work settings and where I sit. But yeah, closing up our interview, what is the one message that you want to give to our viewers right now during this lockdown period, during this pandemic that we are all facing right now? How should people keep positive and stay strong in this time?
Yeah, I think the biggest message that the Department of Health has been echoing for the past few weeks is that everyone should stay at home. So I'm going to echo the same message, that stay at home as much as you can, keep safe, and keep yourself busy with something productive in the house, like reading, stimulating your brain, and just doing something that you know will benefit from when this time ends. So my biggest message is keep productive, but stay at home.
Thank you so much, Gia, for joining us and allowing us in your space for this wonderful time. We appreciate your insights. I feel like I'm more educated now, like I know what to need to do. So thank you so much. Rebatho Foundation people, viewers, thank you for tuning in. Please make sure that you do subscribe to our page, follow us, view us on our link, we on our website as well. Throw us any questions that you want to know from this interview. And Gia, is there any way that people can follow you or try to be in contact with you after this?
Yes, definitely. Anyone can visit my website, which is www.kmphysio.co.za, and everything we've discussed today, you will get a bit more information on that. And if ever anyone needs a consultation, then my details are there and we can communicate on my Facebook page. Everything is on the website. So if anyone can visit that website, www.kmphysio.co.za, and I'll see you guys there.
Thank you so much. Well, we've got it. Here we go. Thank you for joining us in this interview. We're saying stay safe, be at home, stop the spread of corona, and keep yourself fit and healthy. From us, Rebatho Foundation, I am Lerato. Thank you for joining us today. Thank you, Gia.
Bye. Thank you.
Bye.